Anytime you hear the word cancer as a potential diagnosis for you or a loved one, it can create a lot of emotional release that makes it hard to think clearly. And what often happens is all of a sudden you're agreeing to a treatment or a treatment plan out of fear without having asked the right questions. Now, I'm not going to sit here in this video and say no one should ever do a particular treatment, whether integrative or chemo and radiation. But in my opinion, from what I've experienced from family members who have gone through cancer treatment, one who we lost because of the treatment, and from my own cancer journey when I had a melanoma cut out, it is very evident that the standard conventional cancer industry will push towards a particular treatment protocol or line of treatment protocol without necessarily providing enough information for people to make what I think is always the accurate choice. Now again, it might be to do that treatment or it might not, but if you don't ask the following questions, in my opinion, you are missing out on getting the valuable information you need to make the right decision for you and or your family. So in no particular order, here is every single question, plus I'm missing some, that I think you should ask the cancer doctor if you or a loved one gets diagnosed. First of all, what's the 5-year survival rate from my diagnosis? You need to know, is this something that I have a very low chance of living, I need to be willing to do everything, or are my chances quite high and I have some time? You need to ask, what do you think would happen if I don't start your proposed treatment for the next 90 days? So why jump immediately into treatment if it's not something that's about to kill you, when you can say, well, I need time to make a decision? And on top of that, then ask, what evidence do you have that it will spread or speed up aggressively in the next 3 months if I take my time to make a decision on treatment? You also need to ask, what's the success rate with the treatment you're proposing? So often these doctors will tell you, yep, here's what we're going to do, boom, 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 without you finding out that what if that particular treatment for that particular cancer doesn't have a very high likelihood of survival or success. You might want to go and investigate all your options and still maybe come back to that. See, again, every time I do a video like this, I'll get attacked that it's dangerous misinformation, but you have to ask questions so that you can make the best decision. I would also for sure be asking, what percentage of people who come to you with this cancer or any in general leave cancer-free, alive, and don't relapse out of remission in the next 10 years? Is that a high number or not? Then you could say from that, what percentage of people in general survive? How many have you lost with cancer? What are your rates compared to industry-wide? And what are the industry-wide rates? Because then you can go and talk to an integrative doctor, and let's say that only 40% of people with this cancer survive in the conventional industry, and your doctor's right around there, but you might meet an integrative doctor who has an 80% survival rate. Wouldn't you want to know that? You should also ask about the testing and the research behind these drugs. Ask about these, especially the chemo drugs, but also radiation. When these drugs are approved in testing, what was the actual success rate? Did the mice they tested on stay alive for long periods, or did they stay alive just enough for that chemo drug to be approved? And I don't want to go down the rabbit hole here. You need to go and do your own research on how these things are approved, but it's not always as good as what you would think, meaning it's not about keeping these animals alive with these tumors. It's about, can we prolong life for a certain period of time without worrying about quality of life? Then that leads to the next question. What will my quality of life be if I do this treatment? Is this treatment going to ruin my quality of life to keep me alive for 2 years? Or is it going to improve my quality of life? Are you concerned with how toxic this proposed treatment is going to be on my body? Because the way I look at some of these treatments is, if you walked in there and said, hey, we all have some cancer cells in our body every day, hopefully our immune system is walling them up and getting rid of them, but because of that I want to do some chemotherapy as maintenance, would you give that to me for maintenance therapy? And if not, why not? And we know that to beat cancer, your immune system has to be working perfectly to help your body find and wall off and destroy those cancer cells. So I would also be asking that doctor, what do I need to do to improve my immune system's ability to fight this cancer? And are you worried that your proposed treatment will weaken it further? If they say no, they're not worried about that at all, I would have some major concerns and I'd probably get another opinion. Then I would ask that, are you opposed to me getting other opinions, both from doctors within the oncology world and from the integrative cancer world? No doctor ever anywhere in any field should ever have a problem with you getting a second opinion. If they do, again, that's a huge red flag. I would then ask the doctor straight up, especially if they're recommending chemo and or radiation, what other treatment options have you you tried, tested, studied, or spoken to other doctors about? And have you ever worked with or spoken with doctors who treat cancer with an integrative approach? If their answer to all of that is there is no science behind it, and it's all garbage and this is the only way to do it, again, I would have some major concerns, but that's up to you to make that decision if that's the answer you get. Then I would ask, should I be concerned that the cancer treatment industry appears to be captured by pharmaceutical money and not enough research dollars are thrown at anything other than chemo and radiation? Because you will meet integrative cancer doctors who have patients coming in who have been left for dead by conventional. And again, I'm not saying it's the only approach. Please don't get lost in the message I'm trying to give here by focusing on that. But they've got so many people in these integrative cancer centers who've been left for dead and are now alive 5, 10, 15, 20 years later through using these techniques that a lot of conventional doctors will tell you is absolute garbage because there's no science behind it, which isn't true. But it takes a lot of money to do really good quality scientific studies. Pharmaceutical companies can throw loads of money at it. They can pay doctors to say, here's the result we want. It doesn't make the scientists corrupt. They just say, we want you to try and find this result. And if you have millions of dollars of grants relying on it, you're going to go looking for it. That's human nature. We would all do it. So in my opinion, not enough money is spent researching the other methods. Let's find out what really does work and doesn't work, because then we can help more people. One of the most important questions I would ask on day one, this is to me is the biggest red flag, ask, does it matter what foods I eat and what foods I should avoid? And then if they say no, it doesn't, I would then ask, what evidence do you have that diet has no bearing on cancer? Because it's, to me, at least from what I can see in the research, it is indisputable that certain foods and sugars and chemicals are going to drive cancer. Cancer is a response to an internal environment that's going on that the cells can't survive in their normal state. And if you keep feeding that cancer certain foods that it likes, how are you ever going to stop it running rampant? So if a doctor says diet has no bearing on it whatsoever, you really need to go and find another cancer doctor. Then I would ask, should I be using water fasts to try and heal my body? And not saying only that would work, but there's a lot of evidence emerging that by doing 3 to 5 to longer day water fasts can really help your body manage the cancer, and it can eat fast and can even help the chemo work better, get into the cancer and get out of the body without causing as many side effects. Probably important to know. So I'd also have concerns if the doctor didn't know that. I would also be asking, is there anything I should do to balance or calm down any emotional stress? Or do you think that has no bearing on cancer? Because it's becoming more and more clear that cancer is multifactorial. There's a lot of factors that are involved in it. The toxins we're dealing with every day, physical stress where your body maybe can't drain in a certain area because it gets so tight, obviously all the chemical stress, but also emotional stress. There is no dispute, in my opinion, that that is a part of it. Now, are you going to go and meditate yourself healthy? For most people, probably not, but it's a component of it. And again, if your doctor's not looking at these things, they're not helping you get to the root cause. Then I would ask, do I need to take steps to help my body detoxify better and avoid toxins in general? Again, if they say no, they're just looking at bombing your cancer with a certain pretty toxic medication and not doing anything to help your body detoxify so that even if you do survive, you're doing better in the future. I'd also ask, is there any chance that your cancer is being driven by parasites or other underlying infections? If you look at a lot of the research that the NIH has and coming out of the military medical records, it's becoming more and more clear that parasites are a huge component behind driving cancer. And not just parasites, a lot of different underlying infections and viruses and things like that. We know that with cervical cancer. That's why they've tried to really push these Gardasil and other cervical cancer style vaccines. It's because they're trying to target a virus that they think is driving that cancer. Now, again, this isn't a video on whether those vaccines are working or not, but that concept is well known in the conventional world. And it blows my mind that we're not doing more to try and wipe out some of these infections like parasites when the evidence is emerging, along with the other treatment. Then you need to know about what side effects you should expect from the treatment. And is there anything you can do to limit that? See, there's a lot of emerging research that if you do chemotherapy at night or you do it while fasted, you're going to have less side effects. That's important to know. Hey, Dr. Rodney here. If you want to get my free PDF, 5 hacks for boosting your immune system, just go into the description of this video, click on the link, download it, and if you have any questions on it, just send me a message and I'll help you out with it. Do you have any concerns, doctor, that the treatment could be worse than the cancer? Because we know that 98% roughly of people who die of cancer don't die from their primary tumor. They either die of spread spread or because of the treatment. That's how we lost my brother. He was killed by the treatment. Had a cancer that was probably going to kill him anyway, but we lost some years with him because of the treatment he did. And then I'd ask the follow-up question, could this treatment cause the cancer to spread? Because there's certain tumors that you start opening up the blood supply to it and the chemo gets in and causes all sorts of things to happen, it can spread faster. I've seen it happen to multiple people. Then ask them, does chemo or radiation actually kill cancer cells? It's an important question to ask, and if they say yes, then you personally need to go and start doing some research on how chemo works and look at the difference between stunning cancer cells versus actually killing them. Also ask them, have you ever dealt with or spoken to any people, especially your own patients, who decided not to do your recommended treatment or started and then stopped because it wasn't helping them and then went down a different integrative model and survived anyway? And if you did, have you asked them about what they did, or do you just not look into that at all? Again, a very, very valid question that I think everyone should be asking, because what happens to these people who are left for dead by conventional but are still alive 20 years later? Are these oncology doctors going and diving in with curiosity and a beginner's mindset on, well, what did the integrative center do where they went there? Or are they just saying, it's all garbage? But you can't say that if their stats are good. And I'm not saying their stats are always good, but what would happen if you found an integrative place that, let's say, had and I'm just pulling numbers out of my head, but let's say they had an 80% survival rate for certain cancers and conventional had 20 or 30 or 40%. Shouldn't we go and look and find out, well, what part of that integrative is bringing about that rate? Because I bet in some situations it probably is that market. I would also ask, are you opposed to me trying an integrative approach first and then coming back to you if it doesn't work? Again, if the ego is out of the way, that doctor might say, well, I don't think it's a good idea because I feel like you have to get started on this immediately, but you've got to do what's best for you. The patient has to do what they believe is going to help them the most, because so much of that mental aspect of it is so important. So that's a big deal. I would then also, depending on certain things that you might have had proposed to you, like if they want to remove lymph nodes, I would ask them, aren't you concerned that removing lymph nodes takes away a vital part of my immune system's ability to target and wipe out this cancer? Now again, I am not saying that you should or shouldn't have them taken out. I just think more questions need to be asked before we go haphazardly pull a whole bunch of these things out that are a very, very important part of our immune system. But we're also talking the same industry that will rip out a gallbladder or do a hysterectomy without trying too many other things first either, so it's not super surprising. And if you've been prescribed chemotherapy, ask them about insulin potentiated chemo. A lot of the integrated centers use this. They hook chemotherapy to insulin molecules, and they can use about a 5 or 10% dose of a normal chemo. They have you fast for about 24 hours, so hopefully the cancer cells are starving. Then they pump the insulin into the body, and the idea is the cancer will gobble it up, and then now the chemo is inside the cancer cells, so you can wipe out more of it with less side effects because you're using less dosage. Now again, I'm not saying that that is the right answer for everyone or even a lot of people, but you've got loads of different things like this that are being used around the world by integrative doctors, in some cases to a lot of success. I just don't understand why as a doctor we wouldn't be more curious, an oncology doctor wouldn't be more curious to go and ask those questions and really say, well, is there a better way? Because we can all see what chemo and radiation does to the body. Okay, so sometimes it might be needed, but there is no question that there's a lot of side effects that come with it. You are poisoning the entire body and hoping that you can wipe out the cancer before the chemo wipes out the human. So I will never, ever, ever understand. I understand from the money standpoint why it's not pushed more. We're just straight down chemo and radiation, but I can't understand why an oncology doctor wouldn't want to go and meet with these integrative doctors and say, well, what are you doing? What research have you got? What are you seeing in your statistics? And then go back to their higher ups and say, we need to study this thing, because we might be able to help our own patients by adding this. It might not mean stopping chemo. It might be adding other things that means someone has a better survival rate or does less chemo. So the one takeaway I want everyone to get from this video is please, 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 if you're diagnosed with cancer, you need to step back immediately, try and get out of the fight-flight reaction that you'll most certainly be in. You need to get multiple different opinions from doctors inside conventional oncology and doctors from outside of it. And you need to get as much information as possible. You need to understand cancer as best as you can so that you actually know what's going on, so that you can then make the best decision for you. It might be to go and do chemotherapy and or radiation. It might not, but at least have the questions answered that need to be answered. So if you're dealing with this and you've got more questions or more concerns, leave them below, because there's still a ton of questions I left off here, but I can only make a video so long before people start switching it off. So other than that, make sure you hit that subscribe button so you don't miss more videos like this, and thanks for your attention.